It's Wednesday. Welcome to our Wednesday Wellness Tip. Today's physical tip is about preventing or reversing osteoporosis and osteopenia. Some of you may have seen the video that I did a few weeks ago that I told you about falling and hurting my arm. But the miracle is that I did not break any bones. And the reason this is so significant is because 3 or 4 years ago, I was diagnosed with osteoporosis. And I was able to reverse that to osteopenia. And I'm 100% convinced that had I not reversed it, that when I had my accident, I would have broken my arm. So let's talk about how you can reverse or prevent osteoporosis and osteopenia. The first thing is to do weight-bearing exercise. Now, the simplest weight-bearing exercise, of course, is walking. And we have been walking 10,000 steps a day regularly for the past 2 to 3 years. And I definitely feel like this has made a difference. So you can do any weight-bearing exercise. It could be tennis, even doing 10 to 20 jumping jacks a day is a good weight-bearing exercise. So all of these will help. Also, I do believe it's helpful to take supplements. Now, one of the supplements that I take is called Bone Builder Extra Strength. And the reason I like this is because not only does it have some calcium, but it also has a blend of microcrystalline hydroxyapatite that actually helps to increase the bone matrix as well as the bone itself. So it's important to take a calcium supplement. Now that, again, is controversial because we used to be told that women, especially postmenopausal women, needed about 1,500 to 2,000 milligrams of calcium. And now we're finding that that is a little bit too much. Because in many cases, the calcium in the supplements is landing in our arteries, which can lead to plaque and occlusion in the arteries, or even kidney stones. So when I take 2 of these a day, that equates to about 700 milligrams of calcium. And I feel like that's an optimal amount. Then the other thing is that I recently found from a patient taking collagen could be quite helpful. And collagen can really help support your bone strength. She used this collagen that she got from Costco for several months, and then when she had her bone density rechecked, her bone density had increased significantly. And she admitted that she was not exercising as much as she would like. And the only thing she had changed was the collagen powder. Her GYN was so impressed with that even her GYN went and purchased some of the collagen. And thirdly, I want to talk about hormones, because hormone replacement, of course, again, becomes very controversial. I do take bioidentical hormones, and I believe that the bioidentical hormones are much safer than the conjugated hormones or the prescription hormones. So we use the lowest dose to get the most effect, and again, only bioidentical hormones. So I definitely believe in that these have also helped with my bone density. So remember that it is possible to reverse osteoporosis and osteopenia without some of the prescription medications, because many of those prescription medications have side effects that you don't want to have. So this is a much safer, healthier way to keep your bones healthy. So that's our tip for today. Keep your bones healthy.